In this video by Decplate, we will understand the VA rating for gout, osteomyelitis, tuberculosis of bone and joint, decompression illness, and bursitis. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Understanding the VA ratings for specific conditions helps veterans receive the benefits they deserve. Each condition has unique criteria for evaluation, and understanding these can help in navigating the VA's rating system. Osteomyelitis. Diagnostic code 5000. Osteomyelitis is an infection in a bone, which can be acute, subacute, or chronic. 100% rating for osteomyelitis of the pelvis, vertebrae, or extending into major joints, or with multiple localizations or with a long history of intractability and debility, anemia, amyloid liver changes, or other continuous constitutional symptoms. 60% rating for frequent episodes with constitutional symptoms. 30% rating with definite involucrum or sequestrum, with or without discharging sinus. 20% rating with discharging sinus or other evidence of active infection within the past 5 years. 10% rating, inactive, following repeated episodes, without evidence of active infection in the past 5 years. A 10% rating is assigned in any case of active osteomyelitis where the amputation rating for the affected part is 0%. This 10% rating and other partial ratings of 30% or less are to be combined with ratings for ankylosis, limited motion, non-union or malunion, shortening, etc., subject to the amputation rule. The 60% rating, based on constitutional symptoms, is not subject to the amputation rule. The 20% rating based on activity within the past 5 years is not assignable following the initial infection of active osteomyelitis, with no subsequent reactivation. To qualify for the 10% rating, 2 or more episodes following the initial infection are required. The 20% or 10% rating will be assigned once, only to cover disability at all sites of previously active infection, with a future ending date for the 20% rating. Tuberculosis of bone and joint. Diagnostic code 5001. Tuberculosis affecting the bones and joints can be a severe condition, either active with the rating of 100% or inactive. Decompression illness. Diagnostic code 5011. Decompression illness, also known as the bends, occurs due to rapid changes in pressure, often affecting divers. It can have various manifestations. Rate manifestations under the appropriate diagnostic code within the affected body system, such as arthritis for musculoskeletal residuals, auditory system for vestibular residuals, respiratory system for pulmonary barotrauma residuals, and neurologic system for cerebrovascular accident residuals. Malignant neoplasm of bones. Diagnostic code 5012. This refers to primary or secondary malignant tumors in bones. The 100% rating will be continued for 1 year, following the cessation of surgical, X-ray, antenoplastic chemotherapy, or other prescribed therapeutic procedure. If there has been no local recurrence or metastases, the rating will be based on residuals. Osteoporosis. Diagnostic code 5013. Osteoporosis is a condition where bones become weak and brittle. It can significantly impact mobility and quality of life, often leading to fractures. Osteomalacia. Diagnostic code 5014. Osteomalacia involves the softening of the bones, often due to a vitamin D deficiency. This condition can cause bone pain and muscle weakness. Treatment typically involves vitamin D and calcium supplements to help strengthen the bones. Benign neoplasm of bones. Diagnostic code 5015. This refers to non-cancerous tumors in the bones that can cause bone pain, swelling, and potential structural problems. These tumors are often detected through imaging studies such as X-rays or MRIs. Osteitis deformans. Diagnostic code 5016. Also known as Paget's disease, it involves the abnormal breakdown and formation of bone tissue. Gout. Diagnostic code 5017. Under the VA rating system, gout is rated under diagnostic code 5017. Gout is a type of arthritis caused by the accumulation of uric acid crystals in the joints, leading to sudden and severe pain, swelling, redness, and tenderness in the affected joints. Rating criteria: gout is rated similarly to rheumatoid arthritis under diagnostic code 5002. The rating depends on the frequency and severity of flare-ups, as well as the degree of joint involvement and any resulting limitations in motion or functional impairment. 100% disability rating. Assigned for active disease processes with severely incapacitating exacerbations, constitutional manifestations associated with active joint involvement, and total incapacitation. 60% disability rating. Frequent exacerbations and severe impairment of health. 40% disability rating. Symptom combinations productive of definite impairment of health, with incapacitating exacerbations occurring 3 or more times a year. 20% disability rating. 1 or 2 exacerbations a year in a well-established diagnosis. 10% disability rating, less frequent exacerbations. Bursitis. Diagnostic code 5019. Bursitis involves inflammation of the bursae, the small sacs of fluid that cushion the bones, tendons, and muscles near joints. Myositis. Diagnostic code 5021. Myositis is inflammation of the muscles, which can cause muscle weakness, pain, and swelling. This condition can result from infections, autoimmune diseases, or medications. Heterotopic ossification. Diagnostic code 5023. Heterotopic ossification involves the abnormal growth of bone tissue in muscles, tendons, or other soft tissues, often following trauma or surgery. This condition can cause pain, swelling, and reduced range of motion in the affected area. Tenosynovitis, tendinitis, tendinosis, or tendinopathy. Diagnostic code 5024. These conditions refer to inflammation or degeneration of the tendons and their surrounding sheets, leading to pain, swelling, and impaired function. Commonly caused by overuse, injury, or repetitive motion, these conditions are diagnosed through physical examination and imaging studies like ultrasound or MRI. Evaluate the diseases under diagnostic codes 5013 through 5024 as degenerative arthritis, based on limitation of motion of affected parts. They will be rated under diagnostic code 5003. Degenerative arthritis established by X-ray findings will be rated on the basis of limitation of motion under the appropriate diagnostic codes for the specific joint or joints involved, diagnostic code 5200. When, however, the limitation of motion of the specific joint or joints involved is non-compensable under the appropriate diagnostic codes. A rating of 10% is for application for each such major joint or group of minor joints affected by limitation of motion, to be combined, not added under diagnostic code 5003. Limitation of motion must be objectively confirmed by findings such as swelling, muscle spasm, or satisfactory evidence of painful motion. In the absence of limitation of motion, rate as below. With X-ray evidence of involvement of 2 or more major joints or 2 or more minor joint groups, with occasional incapacitating exacerbations, rating 20%. With X-ray evidence of involvement of 2 or more major joints or 2 or more minor joint groups, rating 10%. Thank you for watching this video. Please don't forget to subscribe and like our videos.